Bapak Ibu, izin memulai kegiatan kita pada pagi hari ini. Assalamualaikum warahmatullahi wabarakatuh. Very good morning, ladies and gentlemen. Welcome to sharing session with topic Digital Health Service Platform from Everyone and Everywhere on Thursday, August 26, 2025. Held by Natural Language Processing Research Group, Research Center for Data and Information Sciences, National Research and Innovation Agency of Indonesia. This webinar is conducted in hybrid format, both on-site in Science and Technology area Sama Unsan Medikun in Bandung and virtually through Zoom meeting application. And I'm Kristanti Permata VDRC, and I'll be served as the host of this sharing session. It's an honor for me to inform you that among us here we have distinguished chairman of Research Center Research Organization for Electronics and Informatics BRIN, Mr. Budi Prawara, distinguished head of Research Center for Data and Information Sciences, Mr. Esa Prakasa, distinguished speaker Prof. Sin Bungki, lecturer and head of AI Lab Pungkyong National University, South Korea, distinguished moderator, Mr. Tedu Uliniansyah from Research Center for Data and Information Sciences, BRIN, and all participants and guests. Before we proceed our first agenda, I would like to inform all of participants regarding webinar rules of conduct. Please mute your Zoom meeting. If you have any question, please type your brief question or use raise hand feature on your Zoom meeting. Change your name into your name underscore your institution. Participants are welcome to use virtual background provided by the organizer. And participants may also join the webinar through the BRIN Indonesia YouTube channel. Ladies and gentlemen, step to the next agenda. I would like to invite all participants to rise and sing National Indonesian Anthem, Indonesia Raya. Ladies and gentlemen, please be seated. We are now in the opening ceremony. Ladies and gentlemen, we are pleased to invite the distinguished chairman of Research Organization for Electronics and Informatics BRIN, Mr. Budi Perawara, to deliver opening remarks through the video. To host, please play the video.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, distinguished guests, colleagues, and participants. It is my great honor to welcome you all to today's webinar, part of our Research Center for Data Science and Information Sharing sessions, focusing on one of the most transformative topics of our time, digital health service platform for everyone and everywhere. I extend my warmest welcome to our esteemed keynote speaker, Professor Shin Bo-ki from Pukyong National University, to share his invaluable expertise in AI and digital health technologies. I also acknowledge Dr. Elsa Prakasa, Head of Research Center for Data and Information Sciences, and Dr. M. Teduh Ulyansyah, our moderator, as well as Head of NLP Research Group, who will guide us through today's webinar and discussions. Ladies and gentlemen, we stand at an unprecedented inflection point in healthcare history. The future of health and medical services is not merely becoming digitalized or integrated, it is poised to become truly intelligent. This transformation represents more than technological advancement. It embodies our collective commitment to ensuring that healthcare services are efficient, accessible, and available to everyone everywhere. The COVID-19 pandemic served as a powerful catalyst, accelerating the adoption of digital health solutions and revealing both the potential and urgent necessity for a comprehensive digital health platform. Today, we recognize that healthcare is not just a trillion-dollar business, it is fundamentally about communities scattered across more than 17,000 islands, many in remote and underserved areas where traditional healthcare infrastructures remain limited. This geographical reality makes the concept of healthcare for everyone everywhere not just an aspiration, but an absolute necessity. The statistics are sobering. Millions of our fellow citizens still lack adequate access to quality healthcare services. Geographic isolations, limited transportation infrastructure, and shortage of healthcare professionals in remote areas create barriers that technology can uniquely address. This is where digital health platforms become not just innovative solutions, but lifelines for our people. Today's presentation will explore how the convergence of multiple technologies such as artificial intelligence, NLP, telemedicine, and integrated system can create a comprehensive digital health ecosystem. Imagine a platform where a farmer in remote Papua can consult with a specialist in Jakarta, where AI-powered system can provide preliminary screening, where natural language processing can break down language barriers, and where all stakeholders like patients, healthcare providers, and administrators work seamlessly within an integrated framework. As the head of research organization for electronics and informatics at BRIN, I can affirm our unwavering commitment to advancing research that directly impact public welfare. Our work in natural language processing, AI, and distributed system finds direct application in digital health innovation. We recognize that creating truly effective digital health platform requires interdisciplinary collaboration. It demands the coverage of computer science, medical expertise, public health knowledge, policy understanding, and most importantly, deep empathy for the human experience of seeking healthcare. Professor Sinbokis presents today exemplifies the power of international South Korea's remarkable success in implementing digital health technology offers valuable insight that we can adapt and contextualize for Indonesia's unique needs. Today's discussion will present concept and propose scenario for realizing healthy society accessible to people scattered far and wide. We will explore how to design integrated platform that encompass all stakeholders, serving healthcare providers and patients alike with efficiency and compassion. In closing, let me reiterate that medical and healthcare research represent one of the most impactful areas of scientific inquiry. The work we do today in digital health platform will determine whether future generations have equitable access to quality healthcare, regardless of where they are born or choose to live. With that vision in mind and with deep gratitude to our speakers and participants, I am pleased to officially open today's webinar on digital health service platform for everyone and everywhere. May our discussion be fruitful, our learning be profound, and our commitment to health inquiry be strengthened. Thank you, and I wish you all an enlightening and inspiring sessions. Thank you very much.
Ladies and gentlemen, before we start our agenda, we will be taking a picture together. For participants in the Zoom meeting, please activate your camera and video function. And I would like to invite the IT team to assist in taking a picture. And participant in this meeting room, please follow the photographer's instruction, and we will be taking a picture in front of our meeting room. Thank you very much. Silakan Bapak Ibu untuk menyalakan videonya. Please activate your video and camera function. We will take a picture. We have 3 slides. For the first slide, 1, 2, 3. For the second slide, 1, 2, 3. And for the last slide, 1, 2, 3. Thank you very much for your cooperation, and please wait until the photo session here finish. Thank you. Ladies and gentlemen, we will continue our sharing session. Now reach to our main agenda, but before I give the screen to the moderator, I would like to read the discussion session guide. Participant may ask question using the raise hand feature or chat your brief question in the chat box. And due to the time constraint, the moderator will will present only selected question to the speaker during the discussion session. So, ladies and gentlemen, I believe today is going to be a fruitful day because on our main agenda we will have Prof. Sin Bongki, lecturer and head of AI lab Gyeong National University, South Korea as the speakers. And for the presentation and discussion session will be presided over by Mr. Tudu Winiansyah as the moderator. But before that, I would like to read his brief biography. Mr. Teduh Uliniansyah is a senior engineering from Research Center for Data and Information Sciences BRIN. He graduated his bachelor degree in telecommunication engineering, Shibaura Institute of Technology, Japan in 1991. He held his master degree in computer science from Oklahoma State University, USA in 1998. And he had his doctoral degree in media governance, Keio University, Japan in 2007. He has interest in natural language processing, speech processing, and machine learning. And to Mr. Tudu, I leave this session to you and you may take the floor.
Thank you, Miss Tanti. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi. Good morning, ladies and gentlemen, distinguished guests, colleagues, and participants joining us here in Bandung as well as online. It is my pleasure and a great honor for us to welcome you to today's sharing session on digital health service platform for everyone and everywhere, organized by the Natural Language Processing Research Group, Research Center for Data and Information Sciences, Research Organization for Electronics and Informatics at BRIN. Our distinguished speaker today is Professor Bongki Sin from Pukyong National University of Korea. I hope I pronounce it correctly. I'm sorry. Okay. Allow me to briefly introduce him. Professor Sin is a full professor at the Department of Computer and Artificial Intelligence at Pukyong National University. He earned his PhD in computer science from KIST, specializing in statistical modeling and pattern recognition. His research spans statistical pattern recognition, human activity modeling, hidden Markov models, topic modeling, and AI for healthcare. Over the course of his career, he has published extensively, received numerous best paper awards, and contributed significantly to advancing artificial intelligence and its applications, including healthcare and remote health services. Today, he will be sharing his insight on how digital health platforms enhanced by AI and NLP technologies can bring equitable healthcare access to communities anytime, anywhere. Before we begin, a quick reminder and kind reminder to all participants, whether you are joining us physically at KST Samaun Samadikun or online, that we will have a Q&A session after the presentation. Please save your questions until the end. For our online participants, you may type your questions into the chat box and we will address your questions during the discussion segment. Without further ado, please join me in welcoming Professor Bongki Sin to deliver his presentation. Professor, you may start.
Morning. Presentation material. Okay. Good morning. I'm very happy to have an opportunity to talk about this topic, which is actually somewhat different from my area of expertise. I've studied technology aspect of artificial intelligence and machine learning and pattern recognition. So I'm purely a AI or machine learning science guy. Okay. But this idea of applying the technology to healthcare has occurred about 10 years ago because of some event that occurred suddenly that took the world by storm. Okay, it's next page. Oh, no. Oh, yes, this one. Oh, no. It is much slow. It's not very, it's going fast. There's no going back.
No, this is for the next slide, and this is for previous slide.
Yeah.
You can go back with the.
Okay, thank you.
Is it working?
Mm. This one, yes. In 2020, you know this image, right? COVID-19, coronavirus number 19, that took the world by storm. It surprised us, okay? That copied 100 years ago, the coronavirus flu. Because of this, okay, we had a very hard time for many years. Okay. I accessed many news around the world, and I felt some pity that many Indonesians had very hard time in coping with this crisis. And according to my knowledge, many of the countries in the world are not equipped with sufficient health care. So many countries have had a very hard time to fighting against coronavirus. That is the moment when I got conceived of the idea of using the technology to finding some solutions for the world. Okay. And recently, you know, the billionaire Bill Gates visited Korea. Okay, I'm while I'm reading news all the time concerning my topic. He is the CEO of the Gates Foundation. He remarked that there will be a crisis sooner or later on global health and future pandemic. So he discussed global health, future pandemic preparedness. That's the point of what I find it keen interest in, and other issues. Then the question is, how can we be better prepared for the next pandemic? And prepare next public crisis, healthcare crisis. We need digital technology. So that's the moment I conceived my idea of this talk. Okay, and I tried to find the relevant picture from the internet. I found this picture. This is the guy from, I don't know, some African continent, village people who are remote from healthcare facilities. Are we prepared for the healthcare for these guys? So I thought of rural remote healthcare or telemedicine, something. And I thought of back then, my former student, Dr. Kokoi, was with me, and we discussed a lot. And then, wow, this is a wonderful opportunity for me. I am a technology guy, and I have some experience of applying AI and computer science technology to for the solution of this healthcare. So that was a starting point. And I thought of Indonesia, the right place for doing something.
Ya, caranya dia kan benar yang Tante in-share tadi.
Okay.
Di sharing session ni kan, ni Alian, ni download dulu ya. Ni dulu, kan? Ni kan dah masuk sini nanti. Satu, di Zoom ini,
Excuse me. Could please anyone mute your microphones? Thank you.
Okay, I'll continue. Okay. And we need public healthcare in poor rural and remote areas, and people on Indonesia remote and islands across Indonesia. The right place for remote healthcare or telehealthcare is, okay, and all across African continent. Next step. That's my grand hope. Okay. Next page. Next page. It's not working. It's not working. Next.
The top one.
Top one? Okay, yes. But most healthcare professionals are concentrated around the cities, urban centers or cities or metropolitan areas. Okay, as you see the map on the left, most healthcare facilities are located around the big metropolitan cities, Seoul on the top left and Busan bottom right, and okay, and the healthcare facilities are scarce elsewhere, right? And it is the same in Indonesia. Most healthcare facilities are concentrated on Java Island, or maybe probably big urban cities, right? And it's very sparse or scarce in other big islands in Kalimantan, Sumatra. Okay, I remember the correct name. Okay. So they are the healthcare providers are concentrated on metropolitan cities. They have a lofty goal of providing medical service to people, but they go after money, right? It's natural because they go where the demand is, right? Okay, I understand, but we need healthcare for remote corner people in remote and rural areas as well. That's the point I want to emphasize. Okay, next. Okay. And what I want to pursue is number 2 here, direction of improving rural healthcare to reduce health inequality. Okay. So my eyesight is not good. It's difficult to read the small characters. So I skip over it. Yes. You read the bottom 4 items yourself. Okay. First point of contact. Okay, I'd like to give first point of contact service to people around across the island. Okay. And the solutions establishing online. It lies in establishing online using technology. Okay. Healthcare services to rural and remote areas. Okay. And my motto is giving the service anytime, anywhere. Okay. When there is demand. Okay. And this is possible with the technology over the internet. And the benefits include many items on the bottom figure. And the figure may not be precise, but you can read it with a grain of salt. Next. 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 Okay, quite slow. Now let's start with no, back. Okay, maybe back. Back again. I'll try. Okay. Yes. Okay. Now let's be more technological. The healthcare system, in my understanding, is a kind of a complex system involving lots of components, technological components, or organizations and stakeholders. Okay. The center figure graph may be irrelevant, but in my mind, the components involved includes patients, top left, okay, doctors, top right, and many others, medical or organizations or medical records, health clinics or hospitals, health insurance as well. They must be included, and payments, government, and pharmacists as well should be included. It's a complex system involving a lot of interactions. Okay, it's immensely complex that while after starting my concept, okay, I became overwhelmed by the complexity of this service system. Okay. Anyway, we should start small and plan for the grand design. Yes. So let me start with the simplified version of my concept. Okay, this is the overall organization of my design, a starter proof of concept design that I've developed for the past 5 some years. It includes a lot of components on the top left, okay, small text that I cannot read here. Anyway, it consists of 3 components. First, bottom, top left, top center is a server that does almost everything related to remote health. And bottom left is cloud of patients that access the system or service anytime, anywhere on the internet using any kind of devices, including desktop computers or smartphone or mobile devices. Okay. They access the system with any kind of symptoms, okay, their problems. Then the server, another kind of user, is waiting across the internet on the top, bottom left, right, are doctors. Okay, doctors. They are another kind of users or clients, and there are many with different expertise. Okay. And the patients and doctors are connected together one-to-one and proceed their diagnosis session. Okay. So this is a very simplified version of my concept. Okay. Then I will elaborate this design, and somewhere in the next some pages, maybe I will refer to the need for some AI and machine learning, some recent or advanced technologies. Okay. There are possible service modes. Okay, it can be just text chatting. Okay, it's not very responsive, or message based. Okay, it could be very slow, but in the future, I will also try to expand the service with video or voice-based consultation. This is what most people or business people want to start with, but I haven't expanded my prototype yet to this domain, voice and video consultation. Okay, we will need video conferencing or Zoom service. Okay, this is the look of my server. It's a simplified version, and it's been developed quite long ago, so it is not improved, but it gives me a sufficient picture for my concept. Okay. On the top center left, there is a text. Patient clients enter this service, contact, access the service, and it enters this queue. Then he or she decides on which department to go, and then he or she will be directed to some of the department of the remote healthcare service center. And I introduced some map on the bottom, okay, because I always thought of Indonesia as the prime destination, okay, for my first effort. Okay, so somewhere on the archipelago of Indonesia, patients will access the service and doctors will be waiting somewhere else. Okay. maybe in urban centers. So doctors can serve people anywhere on the island. Next. Yes. Okay. And at the bottom on the map, okay, blue squares represent doctors, okay, serving remotely, and red circles represent patients accessing the service anywhere on the internet or on the island. Okay. They will meet over the internet, and they provide and receive the relevant service for about their health care. Yes. And then on the map, I just tried for my entertainment. Okay, it's a magnifier. Then you can zoom in on the location around the location of the patients for medicine delivery, delivering medicines when the prescription is ready. Okay. Then let me introduce some functionalities of the server. Functionalities, what the server is doing. There's so many text, yes. And my eyesight is too poor. I cannot read any of the characters. Okay, let me tell you, okay. Good, okay. Server manages a lot of databases. It's an information system, right? Information system means that there's a lot of information. It involves the client database that has signed in to the system. So they may include member patients or doctors or many other stakeholders. And healthcare records, which are really important healthcare records that can be accessed and shared across all the healthcare facilities or healthcare providers. Then in detail, there are many other informations or relevant informations regarding the service. Okay, patients and doctors can make an appointment for next visit, right? Okay, and then when the appointment arrives, time of appointment arrives, they need to notify or remind the appointment and many other service statistics. Okay. Is it time for a break? Wow. Okay, let me continue. Okay, and there will be many statistics. Well, how the amount of service that the doctors have made, and about the statistics of current statistics, and about patients. And finally, I added banner ads. Would you move the screen to the top right corner? It's a small picture image about banner ads advertisement. So you can access doctor directly by clicking the ad banner. Okay. And okay, let me move on. Then the server also has a lot of other functionalities. It accepts requests from patients across the internet. So you have to sign in the system, right? So patients, doctors, systems. And I'm not sure that some nurse helping doctors or village nurse may need to access the system or services. Okay. And they may include many other payment agents or health insurance agents, government, pharmacists. Okay. Anyway, they have to sign into the system. And the system may have to manage the patient-doctor service session. This is the point where I poured most of my time and effort into for the past 5 years. Then, serve clients in many different modes, text chatting or asynchronous chatting, send appointments, relay data, because the diagnosis channel session may involve image sharing or remote health monitoring, right? Time series signals technologically. And then finally, because this is the age of AI, right? We have to integrate AI service to chatbot or machine learning functions. Okay, here AI can play an important role as AI scribe. At the bottom center, there's figures text in blue, right? AI scribe. This is critically important for this service to be successful in the future. Yes, so I asked my former student, Dr. Koi, okay, this could be an important topic of research in the future right now. Yes, that's what doctors want. Okay, according to my survey, technical survey, this is really important for the success of this service. Okay, it goes well. Now, let me describe some patient aspect, patient client. Okay, for the first time patient, they may have to register to the system, filling in many information, right? Then small text. Okay, so you can read all the text yourself. Okay. Sign in, visit a doctor by an appointment. Okay, there are three modes of accessing the doctors. The third item, visit a doctor by appointment. And I can. It's appointment. Okay, you can access three ways. In later pages, I will give you some demonstration of how patients access doctors. Okay, the demonstration will give you the picture of how the service is going. Okay, and let's move on next page. Okay. Then doctors, this is a very important part of the whole service. Doctors have many roles and functionalities. They have to sign in and they can check their statistics because they are interested in the number or services, the amount of time they invested for this service. Okay, that translates to their income, right? And they will call next patient by appointment or many other ways. Talk with the patient, okay? Talk with the patient, give information and receive images or time series signals. And then finally they give prescription, okay? So here, there's two text, right? AR, MR. We included it somewhere because doctors will surely want to consult AI as information or knowledge source. Okay. And okay, blah blah. It's very difficult to read the text. Okay. So just remember that there are so many functionalities. Most of the functions are concentrated in the component of doctor client. Okay, the picture in my demonstration later, the screen for doctors would be very complex. Okay, next. Yes, now AI functionalities better support doctors. AI doctors can be a receptionist that can guide first-time patients where to go, which department to go, right? Depending on the symptoms. So they have to discuss, ask the receptionist AI where to go. Then the chatbot will have direct to some department. And AI scribe could be a big factor for the AI and many others. Okay. And doctors themselves may also consult AI doctor for alternative treatments, right? They may not know everything, so they may want to consult AI doctors for recent development in the medical technology. Okay. Then machine learning toolkits. It's separate from AI doctors or AI component. Machine learning toolkits include many recent developments in detecting symptoms or tumors or image analysis. Okay. Most medical technology, AI in medicine is made in this area. Okay. They develop medical toolkits for medical data analysis. Okay. And the picture on the right, bottom right, shows if you see an image at the bottom, then machine learning tools may analyze maybe it has eye problem. Okay, so from the image sent by patients, doctors may select some area around the eye, then ask the machine learning tool to any kind of symptoms or decides on the cause of the symptoms. Okay. And the figure on just above it is vital signs sent by the patients. Okay, they can use it for any kind of symptoms, and okay, they can decide the cause or any problem with the signal using machine learning toolkit. Okay. So machine toolkits and AI doctors, they can be separately developed, so they can plug it into my service. Next. Now, let's move on to the client side of doctors. Doctors sign in to this software or page. Okay. Yes. He enters his login name or password, then enters. Yes. For example, Dr. Kim too. Then this is the sign in login page for patients. Okay. Okay. Now let's consider how the clients are connected to the system. Server is on the left, and the page on the top is the first page doctors see when they sign in the system, and bottom is okay. Then this is the page where doctors consult the patients on the internet. Here, this is the page or mobile that patients use. Okay, they can access the system service in many different ways. Okay, there are 4 big buttons. Bottom left is choosing department if they are finding department or doctors. Okay, bottom right is accessing the service by appointment, and at the bottom, very bottom, there are 4 small icons, right? They are banner ads. If you click some button, you can access some doctor directly. It's kind of direct access to doctors, right? So there are many 3 different ways accessing doctors. And at the bottom center, small one is AI doctor. Patients want to access AI chatbot directly to find the right department. Okay, think of that as the image, small image is Dr. Einstein. Okay, he's not a medical doctor. Anyway, he's considered as AI. Okay. Now, okay, if you choose the appointment on bottom right, can you see this this image? Yes. Okay. Then you are notified. Okay, on list of appointment. Okay, and choose and click connect. Then you are asking doctor for meeting, and the doctor will be waiting for you. Okay, so okay, I need laser pointer. Okay, and above a figure, at the bottom right corner of the above a figure, you see a list of small text, right? bottom right corner, small text. That's the list of assignment doctors are a doctor is waiting. So you can connect to the patient via that small corner. Next. Yes, he clicked one and he's connected to the patient. Next. Then this is the page. They are connected together via the appointment, by appointment. Okay. The left figure is the screen that patients see. This concept is not a very beautiful figure, but in top right is the page doctors see. So with this, in this page, they communicate each other, discuss, and then diagnose. So next, yes. And patients, doctors may want some information regarding the patient's symptoms, right? So next. Okay. Next. Yes. Upper button. Okay. Yes. So they are connected. They're connected. Bottom right figure. So they'll discuss on and on. Next. So if you want, doctors may want, okay, give me some picture. Give picture of your eyes. Okay, if you have any trouble with the eye, or online stethoscope. Okay, doctors want to hear the sound of inside your body, right? Stethoscope. Doctors may ask stethoscope to diagnose any symptoms of the patient. Okay. Left figure shows the image sent by patient. Okay. This figure must be taken by mobile phone camera. Then it sends the camera to the right. The figure on the right, top right, is the image that the doctors see. So looking at the image, then doctors can see, well, we may have some problem or trouble. Then he can decide any kind of symptoms or cause of the symptoms, or he can choose a section of the image and ask the chatbot or ask the AI for any kind of possible symptoms. And the bottom left, again, stethoscope, that he may want to hear some sound, okay, and it's related to arrow. Yes, arrow. Yes. Okay. The signal from the stethoscope goes to the bottom right. Okay, in a small panel that shows the signal. Okay, it could be vital signs of your internal body or heart pulse. So using many information sent by the patient, doctors can decide. Okay, you have a trouble. Next. Okay, then the doctor moves on to the next page and prepare some prescription, and we'll close the session. Here, when he make prescription, the AI scribe will play a role or help the doctor, okay, to facilitate the process of diagnosis and making prescription. Okay. Anyway, let's make a close session. Then the prescription is ready and sent to the patient, or maybe possibly to some pharmacist close to the patient, okay, in the neighborhood of patient. Okay, this is my concept. Yes. The doctors may choose the location of the patient on the map at the bottom, then he may choose to send the prescription to the pharmacist, right? Okay. So that the pharmacist can deliver the medicine to the patient via drone or anything. Next. 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 Okay. Yes. Then if you want, patients may want to receive the prescription, right? This is the next page, another page for the patient mobile app. That's where he may want to receive the prescription. Currently, it's not implemented yet. Anyway, but the patient receives the prescription. Okay. The arrow with the question mark has not been implemented, but the patient has received the prescription, but it's not included in the mobile screen. Okay. Then finally, if he's satisfied with the service of the doctor, he may choose yes button or no button at the bottom, green or red. Okay. That's evaluation for doctor's service. I don't know whether doctors like it or not. Maybe they may be against the use of the buttons, okay, evaluation buttons, because they can translate to their reputation on the internet. Next. Okay. Now, doctor returns to the previous screen, and the green, small green light or circle, right? That shows that you are ready for the next patient. Okay. Then he may want to accept the next patient via the bottom right corner. Okay, bottom right corner. There are two bars. One is for new patient, and another one is for by appointment. Anyway, whatever he can choose to accept. Okay, call or invoke another patient. Next. Now, alternative connection. There are other connections to the doctor. Patients. This is a patient screen. Patients may want to find a department on the right. There are 5 departments. Okay, internal medicine, psychology, cardiology, whatever. Then choose the department, and you will see a list of doctors currently working on the internet. And choose one and access the doctor. Okay. Yes. Look, find the arrow. Yes. And patients check any information regarding the doctor and choose yes. Go. Go means access the doctor. Or a bottom. Yes, this arrow. There are 4 small icons, right? But they are doctor banners. Okay, you choose one of them. Here, Dr. Zhivago, he's a real doctor, fictional but real doctor in the movie. And if you click it, then some pop-up screen comes up, and you enter some of the symptoms you have, and then click. You access the doctor directly. So many doctors may want, okay, to attract many clients. There are 2 alternative ways of connecting to the doctor, right? So there are 3 ways, okay, that I've implemented in my service. Yes, symptoms. Okay, I have a fever. Then doctors can guess, okay, there is a new customer, new client. There are some symptoms regarding fever. Yes. Next. Okay. Next. Okay. Yes. Now, Dr. Banner. Okay, that's okay. The screen on the left, okay, image on the left shows the server monitor. Okay. This image shows, the screen shows that there are 1 doctor serving in my service, and 1 patient is being served by the doctor. And if you click any button or progress bar, you'll see the list of doctors working currently. Okay. Or you may also choose to see the list of patients currently signed in on the service. Okay. You can do of all departments. Okay, next. Next. Yes. Doctors may also want to consult some patients not online, via online, or just by texting or something like email or a synchronous connection, right? Because some patients may want to access the doctor, may not want to access the doctor because of some privacy or some private symptoms. Okay. So they may not want to, without this kind of mode of access, they may hesitate to access doctors. So you can think of different conditions for patients. So text-based consulting is also possible. So it could be slow, but it could be one option for doctors servicing the patients on the internet. There are not much details, okay, but I'll move on quickly. Next. Then doctors want the progress of symptoms for the patients that he has treated. Doctors may want to remote health monitoring. This is important feature of the remote run health, because they are not watch or touch diagnose the doctors directly, so they may want to the progress of the symptoms. So this is a remote health monitoring feature, which is really important in remote for future medical service. Okay. There are many kind of patients for each doctor. There is a list of patients on the bottom left. Okay, list of patients, and for each patient, okay, the doctors may want to check the development of symptoms remotely. So the point of checking or monitoring on the bottom right icons. Okay. So with this combination, doctors may continuously monitor any kind of important developments in the patients. This feature is a recent development, so it has not been very refined yet. Anyway, I will improve this feature a little more sooner or later. Next. Oh, yes. And this is the page I edited this morning, actually. For remote health monitoring, I'm developing this feature. Okay, I almost completed writing the code, and now I'm ready to include this feature into my service program. Okay, in the previous page. So when I finished this code, it was too late. Okay, so I focused on presenting materials for this event. Okay. So anyway, remote health monitoring feature is already finished. I only have to include this into the previous platform. Okay, is it over? Do I make a closing remark? So Zoom session is planned just 1 hour, probably, yes. And so you may guess that what the patients will be looking by guessing the previous doctor's screen. Patients access the doctor several ways. Okay, the role of patients are not very diverse, so it's limited. But anyway, patients are the clients who will pay the doctors, right? So we should make a very comfortable and insightful, easy access design of the mobile app. Okay. but I haven't paid much attention or effort to the design of a mobile app. Anyway, I'm not sure. Let me see some of the final pages, so then I can make a quick concluding remark. Okay, village medical center. Yes, at the end of my slide, there are three big images, right? Big photo images. The first one is telemedicine. Telemedicine. It's an AI picture, AI image, AI generated image. Okay, I found it. So it's kind of village medical center where with some high-speed internet connection, ordinary village people can access the site and connect to the doctors. Okay, so that they make discuss and send any kind of symptoms or measurements, so they can make remote service via the health service center. And a more realistic picture is the second picture. That shows a real scene in Zambia, Western Zambia in Africa. Okay. That is quite relevant to my concept. Okay. And I was surprised that there is a list of people waiting in queue. Are they not? Okay. And then the last picture shows there is a serious problem that doctors may now want remote telemedicine. Okay, so there is a strict regulation the doctors have against proliferation of remote medicine, but it will soon be overcome. Okay, as my recent survey. The rule or the law is gradually changing bit by bit. So sooner or later, maybe in 5 years in time, the scene of telemedicine will have changed a lot. Okay. So that's the time when I have been looking for. So we have to prepare technology, okay, for that future. That's my concept, overall concept. So there is a list of conclusion points. Maybe it's just a summary of what I've talked, okay, for in my talk. Okay. So this is my verbal summary of what I have wanted to say today. Okay, I'm sorry for my haphazard or messy presentation, but I'd like to receive many. I'm happy to receive many questions regarding my messy ideas. So just before traveling here to Indonesia, it was a Saturday night. I prepared this material for just 2 hours. 2 hours, yes. Just before going to bed. Really going to bed. Okay. I had very stress. Okay. Before the 2 hours, before the preparation, I prepared for my lecture notes, okay, of the workshop or training courses. I had some ideas on many pictures already made in my laptop, but I couldn't make interesting or coherent story into this presentation material. So I sensed that I may not succeed well in this presentation, but I decided to go along anyway. Okay. So please, I'd like to welcome any questions, whatever kind of remark as well.
Okay, thank you very much, Professor Rosin. I think your presentation is very insightful, and I believe that we learn many things from your presentation today. Thank you very much. And so, ladies and gentlemen, we have entered the Q&A sessions. I see in Zoom chat box there is one question from Jonathan Edwards Talaumbaunua. Do you want to ask orally, directly, or should I read them out, Mr. Jonathan? Oh, sorry, my audio is still muted. I'm sorry. Yes, there is one question from Jonathan Edwards Talaumbaunua. Do you want to ask Professor Sin orally, directly? Okay. So, Professor Sin, let me read the questions for you. His name is Jonathan Edwards Talaumbaunua, and he is currently studying robotics engineering with research focus on digitalizing health services using AI and IoT for underserved areas in Indonesia. I'd like to ask if we one day have a fully automated AI system that can diagnose and prescribe treatment, which legal framework would be the most disruptive: medical liability, product liability, or professional accountability? Would such an AI still be considered just a tool, like a scalpel, or would we need an entirely new legal category to assign responsibility when things go wrong?
Okay, there's text question. Okay. My question would be very simple. Okay. The liability is very important in medicine, or healthcare or medicine. Okay. AI will not be fully automated. They cannot make a decision because doctors will not allow that. Okay. Doctors will never allow that. The final liability or responsibility will go to the doctor. So AI or whatever medicine will be used as a tool, assistant, okay, in making the final diagnosis. So that would be a very simple answer. But AI or chatbot or AI doctor could be a wonderful encyclopedia okay, with the direct access, so they can help doctors a lot. Okay. That is the point. AI will not be fully autonomous and work on its own. It will never be the case. Okay.
Sorry. Explains when I talk. It's okay. Okay. I hope that answer your questions, Mr. Jonathan. Okay, we have Mrs. Nurul, Mrs. Susnul here asking a question. Please, Mr. Susnul.
Thank you, Professor, for your wonderful presentation about the platform. I think it's very important, especially in in countries with many remote areas where health facilities have not been placed in that remote areas. But my concern is from your experience in developing this platform, have you identified limitation in the current implementation? For example, whether the current platform only suitable for certain patient condition, or it can covers all patient condition. For example, maybe for chronics, it is not suitable, or only for generic condition. Thank you.
Yes, it will be this kind of service, remote healthcare service, will be limited to certain categories. Yes, it will not cover surgery, right? So it will be limited. But as I pointed out in the first, somewhere in the early stage of the presentation, it will mostly focus on first or primary care. Okay, so if you have the symptom or some damage or symptoms or hurt, then you access doctor, and doctors may diagnose, oh, you have some problem, go where, or some expert. Okay, the doctor may direct the patient to the experts of real care, or if the symptom is not very severe, he or she can make some prescription. So this is first point of access. Yes, that has an important role too for the entire microsteps. So this is first level care, first access, point of access, second point, and third, the most expert level, professional access point. Okay, there is a level of differences. Okay, thank you.
Okay. Sorry. We have another questions from Indra Sari. Do you want to ask your questions orally or directly, Ms. Indra Sari? Okay, I will read them out. Thank you, Professor Shin, for the incredibly insightful presentation. If I may, I have two questions. First, I am very intrigued by the concept of the remote telescope examination. Could you possibly elaborate a bit more on how this process is actually carried out? I'm sorry. And if I understood correctly, it seemed the implementation for your applications UI was in Java. I was curious if there were specific conditions that led to choosing that technology.
Okay, thank you for the question. Concept. Okay. As I said at the start of the presentation, okay, this is the whole service. Okay, it's not service yet. It's developed as a proof of concept. Okay, so it will soon have to be realized in a professional version or business version, and then. With this development, I try to see in every detail. Usually the detail is where the devil is, right? So I try to feel in every detail of the whole service framework. So this will not be the final form for this service. Don't think of this as a service that can be realized sooner or later. It can be used as a guide to develop the realistic commercialized platform. Okay. And any other? I don't know whether my answer is enough for this question. Okay, to be honest, okay, I've developed this software on my own. So this is entirely my personal view. So it could be a lot different ultimately. Okay. So for many years, okay, there has been no one around me. So it's my own concept. Okay, maybe my former student Kokoi will witness, okay, the environment. Okay. Yes, I think I'm not sure this is enough. No, I think that's the question. That's my answer to this question.
Thank you, Mr. Professor Shin. Does that answer your questions, Miss Indrasari? She typed that she has a sore throat. We hope that you will get well soon, Miss Indrasari. Thank you for your questions. Is there any other questions? I don't see one in the chat box. Okay, we have Mr. Tri here asking question. Please, Mr. Tri. Oh, ini. Thank you, Professor Wongri.
We know in the recent year, we hear not only AI, but also blockchain.
Blockchain, yes.
So my question is, do you have any experience of, or maybe a suggestion, how to use blockchains in your digital health service platform? Actually, I almost never heard about the success story of applying blockchains. Maybe you have any idea or experience. Thank you.
Okay, thank you for the question. To be honest, I have little experience in blockchain technology. I have keen interest in the emergence of blockchain technology many years ago because I read a lot of technical magazines or papers. Anyway, in the context of medicine, IT in medicine, I'm not sure where blockchain technology will be used. The more important, in my view, the more important issue is privacy and security. Okay, healthcare information or patient information is really important. It should not be shared across the internet. Okay, usually doctors do not want to share the patient's information, so they always keep the medical records or information on their own. They don't want to share, let it go outside the hospitals. So we have to overcome that kind of hurdle first. So that includes medical, healthcare, medical information, patient information. Okay. So in order to, and the technology that is important in this case is the encryption for information security. Okay, encryption. Then I have little experience in that area too. Okay. So sooner or later, when we have to design the commercialized service system, then I'd like to invite expert professionals in that area too. So we have to start at the design phase. Thus far, I have focused on proof of concept that it can be working, okay? But in the business platform, we have to include all other technology professionals to make the system secure and transparent. Okay. And then, as I told you at the start of the presentation, the healthcare service is really, it's a kind of complex system. It involves many kind of stakeholders. Okay, so we have to standardized and very flexible database. So we need database experts too. So thus far, the whole idea about this remote telemedicine could be somewhat amateuristic, but I'd like to make it a realistic service platform, including involving many professionals, experts in other fields. So I'm thinking of some other fields these days. Okay, maybe sooner or later I should access. Okay. There are other my colleagues in my department. Okay, So they could be the first point of contact for me in that area, in that direction. Okay. Security is the first concern that I'm thinking of. And then I have to converse more, talk more with my colleague in the area of blockchain information security. So it will soon be made clear, okay, with further discussion. Okay, I think that's the only thing that I can share.
Thank you, Mr. Lee. Is that okay? The Mr. Two questions is interesting for me. If there is not yet any questions, I'll add Mr. Three questions regarding the large language model, which has shown many successful stories for the LLM success. Do you think also the same point of view regarding the LLMs compared to the previously asked by Mr. Tri regarding the blockchain technology? I mean, using LLM may help doctors in answering questions, but we should, we can filter the depth of the questions level where we can rely to the LLMs to answer questions. Maybe we can filter if the questions is not fatal. Maybe the LLMs can answer the questions. How do you think about that? Thank you.
Is your question about LLM's role in privacy or transparency?
To some extent, just to answer just to answer trivial questions, not leading to fatal conditions, fatal. Okay.
I'm not sure that I understood your question fully. I have to create my own question based on your question. Okay. I don't know. Okay, I'm just technology guy developing computer science technology, okay, and software engineering, and some of AI. Maybe they two can be combined to prepare to make improved or smart healthcare service in the future. That's the overall picture of my ideas. Then I am not sure the role of LLM in the future in remote health, telehealth, telemedicine. Okay. It will be LLM. I think the role of LLM is not will be important for doctors, but because since LLMs or language models in future or AI in general may not play its own independent role, so I'm not sure whether we should care very much at this point in time about LLMs. Okay, my focus of interest is quite limited in that sense. So I'm not sure whether this is sufficient. Okay, this answer has satisfied you. Okay, this is my interpretation or misinterpretation of your question. Okay.
Okay, thank you. Thank you very much, Prof. There is some comment from Ms. Fabrianti Safitri saying that maybe the questions that if the questions contain some cases that should professionally answer like cancer or other critical disease. So maybe Mrs. Febrianti suggests that the system choose which questions should be able to answer by LLMs or should be answered professionally by physicians like doctors, professionals like that.
Does that mean, okay, some cases that should professionals answer? Okay, there's a serious question. Okay. Okay, as for now, LLMs or chatbots or LLMs are not very accurate. Sometimes they mishear. So as of now, currently doctors should be responsible and check any kind of mistakes that LLMs can make. And I'm not a big fan of LLMs these days because, as I made some remark in the previous class yesterday, because there are many problems related to hallucination. Okay, if you understand the cause of hallucination, that you cannot dare to believe what LLMs say most of the time. Okay? That's my attitude toward LLMs today. So it can be very dangerous or risky, okay, to rely on LLMs for the kind of serious symptoms like cancer or chronic diseases, okay? Because it's a life and death problem, right? If you make a small decision, make a mistake in small decision, there could be life and death problem for the patients. So doctors should with extra care. So even consulting the AI will not be alone. We make repeated confirmation process too. Okay.
Okay, thank you, Professor. My connection is not good. I'm disconnected from the internet. Meanwhile, is there any questions more? Oh yes. Okay, Mas Prabu, please.
Thank you. I want to ask two questions related to slide number 19 and 20. Maybe if mohon maaf Pak Tedu, can you share the presentation again? Oh, okay, it's okay. Okay, it's okay. So in slide 19, if I'm sorry if I miss it. This is a conversation between a patient and a doctor. The patient can send the data and the image from the camera and the sound audio data maybe from the recording. What I want to ask is the step function. Is it a stethoscope? I want to know about more detail about this function. If I'm the patient, do we need to have a stethoscope in home and record the audio and send it to the doctor so doctor can analyze, or I don't know what's the function of more detail about this function, because in slide 20 if I'm see it, this is converted to audio data in wavelength image, and then maybe it is classified into something disease if there's an anomaly in that sound. You classified it to some disease, but what I want to know is how do you transmit the audio from the patient to the doctor? That's the first question. And the second one is actually in Indonesia we have some telemedicine, some popular telemedicine such as I don't know, I forgot. Halodoc. Maybe some of us here already try it. Actually, I already try it once. So the application is quite same like this. The patient can consult to the doctor via online, via the app. But I think it is not quite useful because there's no AI applied in that application. So for my case, in 2020 at COVID, at that time it is COVID. So there is a lump behind my ears, and I consult to the doctor via that app. I send the image, the photo, and I send my data about my medication background. But the doctor said they cannot identify what the disease is because they need to feel or rub the skin to identify what the disease is. So there is no answer in my case. So I don't know. The question is for you is there some technique or methodology to identify some disease that needs that's the examination needs to palpation. So for example, if you want to identify the cancer, the doctor needs to touch you, right? Not just from the image, but to feel if this dangerous or not. Thank you. That's
Okay, thanks for your two questions. The first one was about sharing the data of the patients, right? And it's not that hard. Okay, it's based on computer science technology. Okay, like the technology is based on internet programming. You can using the internet protocols like TCP or IT. You can send any kind of information. Okay, and it can be TCP/IP, or it can be based on IoT devices. Okay. In that case, you can use smartwatches to send any kind of vital signs. Okay, so the technology is already out there, and there are diverse applications regarding that kind of information sharing or data sharing. It's broadly termed as remote health monitoring. Okay. It could be the online health monitoring very fast, or it could be very slow. So it can check, send the data every second or every minute. So it depends on the symptoms the doctors may want to monitor remotely. So, and there may be many features in our body, temperature or heart rates or blood sugar rate or something like that. It can be used. There are several measurement points. Okay, the doctors may want to monitor remotely. Okay. As for the second question, it was about what was it about? Yes.
Is there any technique to if we want to identify some disease that require some palpation in the examination process?
Doctors remotely in this service may sense some problem. Okay, may sense some problem. That could be the doctor's primary role in this service. Okay, then the patients without that information may not know that their disease or conditions are serious, right? So they can waste the time. So with this access, okay, doctors may sense some critical condition, and then he or she may direct to some experts, okay, professionals there. That is the primary role of this medical service. So with AI, okay, it's not easy to detect cancer, because how can you sense cancer that's going on inside the body? You're looking at the skin, right? It's impossible. The patients may not have any kind of device or measurement, okay, but they may have some coarse devices like low scale X-rays or something like that in medical village health telemedicine health centers across the rural areas. Other than that, it's difficult to measure exactly the conditions that cause the symptoms. Okay, so there is a differentiation of services. Okay, thank you for your question.
Okay, hope that satisfies. Okay. Okay, next we have a question from Mrs. Nuraisa. Please, Mrs. Nuraisa.
Thank you. I'm truly interested about the remote and rural areas, because for now our team already in the middle of develop the triad system for rural and remote areas also, and also the identification, the first adenomyosis, endometriosis, it's about women health. And the question is, in Indonesia, we have really limited professional in medical. So about every area, they have different rules. So I want to ask, in your experience, how you make your system not biased towards one area into another area, and how we follow, especially when in Kalimantan they have special disease and it's not really exist and become really great attention in Java, but our government, most of us have a decision, the decision made in Java Island. And I want to ask how you make the great contribution for each areas equally. Thank you.
Okay, thanks for the hard question. Okay. Actually, to be honest, it's a kind of unknown territory for me. So I need a partner here. Okay. And I know some colleagues here that they can facilitate my implementing or realizing my dream here. So that's the reason why I chose Indonesia. Could be the really good point of my starting my dream. Okay, and actually, I'm a technologist. I alone cannot make anything going on. So I need partner. I've already a partner here can work is Indonesian here, working here, and he's kind of alumni of my school. And then we're going to work together and designing for the future. And then with the help from those guys, I'm going to implement this kind of service small. We should start small and expand step by step. And with regional regulations, different regulations, we have to solve the problem one by one. Okay. And there are other problems related to language. There are many dialects, right? So in that area, okay, AI, like chatbots, can play a big role there. So as I told you before at the start of my answering, okay, it's a unknown territory. So I'm scared, okay, how to solve survive in this unknown territory. Maybe if we think twice and try to be smart, we can solve the problem. We humans are problem solvers, right? So I believe that we will ultimately solve all the problems. Okay. Although it may not be a complete success, but we can make some difference in this service. I've heard that government is an important factor.
Does that mean if you come to one area, you try to portray what actually they need first, and after that try to improve the system, or just try to find the general line?
No, we have to customize locally, right? Okay, that is very important for making service that works. Okay, and so technology is not just a small part of the whole equation. Okay. So we have to need the long process of spreading the service to all corners of the country. So there is a long series of customizations and accepting information or persuasion as well. So I expect it could be a real long, hard process. Okay. I expect that. So in that sense, it's my unknown territory. Yeah. But usually it's exciting to go to the unknown territory. That's where your adrenaline goes up, right? Thank you.
Okay, thank you, Mrs. Nuraisa. Next, we have questions from Ms. Yuri Fitriani. Allow me to read the questions out. Since digital health platforms handle sensitive personal data, what strategies should be prioritized to ensure both privacy and trust among users? Thank you.
Yeah. And probably doctors are very hate sharing information. Because in some reason, and currently, I think inclusion could be the one step for the literature. I haven't considered it yet, but I'm trying to include that part that include the use of for improving that amount. Okay, yeah, I can repeat. Yes, private information is really it's maybe the most critical part of the equation. Yes, and it's a simple answer that I'm thinking of is encryption and probably using blockchain technology. And I'm not a very knowledgeable person in that area, so I think very simply. And as of now, as a next step for my software development, I'm thinking of preparing some room for including that features. Okay, time to time, well, if I send my private information, how should I encrypt the information or data that can be sent to the internet, across the internet? So that's the only answer that much is the only answer that I can make. So privacy is as of now, it's a really big question that I have to answer first in order to make a move to the next stage of my development. Okay. So I'm nearing my retirement actually. So the coming semester or the latter half of this year could be the milestone moment of realizing this service. Okay. So the biggest task, okay, or headache, okay, in the next semester will be that kind of privacy or encryption and privacy, and even probably blockchain technology too. So I'm ready to ask to some of the professional experts. Okay. I mean, my colleagues in my department, okay, they're already out there. So I'm ready to discuss. Okay, so that means I haven't solved the problem yet. So I'm thinking of solving the problem in at least this year. Okay, that's all. Thank you for your question.
Thank you, Professor, and thank you for your question, Ms. Yuri Fitriana. We hope that answers your questions. Next, we have questions from Mr. Esa. Please, Mr. Esa.
Yeah. Okay. Thank you, Pak Teduh. Thank you, Prof. Sinbongki, for your comprehensive and impressive presentation for today. Yeah. Actually, I have two questions. Yeah. The first question is, does the system or does the proposed platform use an algorithm to decide or to select the doctor name? Because I saw in the user interface, the system can select the doctor according to the symptom given by the patient. Yeah, and then I just want to know how does the system select a particular doctor for this request. Yeah. And then the second questions, do you have a plan, yeah, to include some function or menu in this platform, especially for live consultation with the doctor? Yeah. For the example, maybe the platform can provide video conference tools or video conference menu, yeah, so the doctor and the patient can conduct discussion interactively. Yeah. Okay, I think that's all my question. Thank you.
Thank you for your question. The two questions are mostly technical. Yes. For the first question, okay. First time customer or client may have to choose which department to go and how to find doctors. You first select a department first. Okay. If you are not sure about which department to go, you may ask AI, give some symptoms that you have. Then the AI will direct or guide you which department to go. Yes. Then that AI may have. In that sense, AI can be a receptionist first. Then once you go to a department, okay, then the system shows a list of doctors who are actively working at the moment. List of doctors. Then patient can choose which doctor. Okay, if you click one doctor, then there's information at the bottom. You will see some information regarding the expertise of the doctor and rating by patients. Okay, doctors may not want. Okay, anyway, you can choose, okay, whether include it or not. Anyway, information. And if it's a little bit different that the patient wants, then try another doctor. Then you check the information. So using back and forth and from the list of doctors, you can choose the right doctor. Yes, that's one way of So this is not that the system automatically directs you to a particular doctor. Okay, the patient can choose, okay, or ask the AI more to be directed to a particular doctor. Okay, that's I think that really the first answer to the first question. For the second question, okay, my memory problem. What was the second question?
The second question, do you have a plan to provide
Oh yeah, I see general interaction,
video conference?
Oh yes.
Yeah.
So I'm not a professional. I'm not expert on video conferencing technology. Okay, I'm thinking of maybe Zoom could be a tool for interaction. Okay, I have checked video conferencing tool, developed video conferencing tool myself. So I searched video conferencing toolkit or libraries, and I tried to think. I thought of developing one myself, but there's so many things to develop, right? So my time is limited. It's all alone. So I should not invest too much time on that interface. So I stopped short of doing that. Anyway, if I have a real team developing commercialized service, then we'll definitely need anyone who is expert or familiar with audio communication, voice communication, or video communication. You may need some technology or codec information like MPEG, okay, for video conference compression, or H263, or there is a protocol regarding video conferencing. Okay, we may use. Okay, if I explore more, then I think I can develop the kind of crude form of video conferencing technology. Okay, but if you have a team, then I can refer the task to my teammate. So there'll be the primary channel of communication between doctors and patients, right? Okay. And thus far, for my proof of concept, I've developed on text-only chatting. Yes. So if you, sorry, one more answers, okay. If you have voice or video chatting, then depending on the choice, okay, or under the permission of patients, the AI can listen to the discussion, right? And this conversation. Then the AI can be used as an AI scribe. They can write down all the conversations. Then at the end of the session, they can make a summary of doctor's consultation. Then they can translate it into doctor's decision or even prescription. Yes. Yes, that's additional answer to your question. Thank you.
Thank you, Mr. Esa. Is there any more questions from the? Okay, we have Mr. Agung here asking questions. Please, Mr. Agung.
Yes, thank you, Prof. Sin, for very interesting concept for telemedicine, and I think it's very needed in Indonesia because of many rural areas and access to health is quite unbalanced, right? But there's a problem, especially for the communication part usually in the rural area, many blank spots, and access to networks is not very good usually. So is there any requirement for like a bandwidth size or something like that for the application to run as expected because of that, or probably like in Indonesia, we have some kind of a health center called Puskesmas that is usually exists in village. Can it become some kind of a temporary point and can make some thing like access point there, and the agents can access through that access point rather than using a coverage like 4G or 3G. So is that already included in your consideration when designing this? Thank you.
Thank you. My idea about this telemedicine or health service started when COVID-19 occurred. Okay, and I thought of remote areas in Indonesia, and there may not be high-speed access to internet. So that's the reason why I thought of text chatting-based communication, because some in remote corners will have 2G. We only have 2G or 3G access, right? So that's the reason why I started thinking of text-based communication or communication. And if you have high-speed connection, okay, like village communication center may have village communication center with high speed. For cities, high-speed communication. Then, if you go to the village communication center, then you can access doctors with video conferencing or audio communication. So there's a level of different level of communication in modes. Yes. Okay. If not, if you have slow, the connection is 2G or very slow. Then you can use 2G phone or 3G phones for text-based communications, or you can use telephone network, right? Okay, for voice communication. Okay, so we have to prepare. Think of services to people in remote corners first. Okay. Yes. So I haven't thought yet. So that's the reason why I haven't thought much about video conferencing, video-based or audio-based communication. Yeah, according to my discussion with my former student from Ethiopia, okay, they have some problem with the sexual violence or something, right? Then girls or ladies may not want to discuss doctors because they may hesitate. That's the reason why I thought of text-based or asynchronous text-based communication. Okay. So we have to take care of minorities as well. Okay, I'm not sure whether this is enough to your question. Okay, thank you.
Thank you.
Okay, thank you, Mr. Agung. Is there any more questions from the floor or maybe online? Okay, if there is no questions, I have a question. So, we have been discussing many problems. But for Indonesia, what is the biggest challenge in implementing digital health services in rural area? Is it infrastructure or perhaps government policies or perhaps any other things? That is the biggest challenges that we have faced to implement digital health services, especially in rural areas.
Right. Okay. When I said unknown territory, okay, most of the big problems remain in the unknown territory. Will be about government sector, and yes, that's the reason why I need many colleagues who can work together, not just help me work, who can work together to realize the service. Okay, I'm not the hero, okay, who is a leader going forward. I'm I want to be a just partner to make the work realize the service. Okay. And I think the government sector could be an important factor in realizing service. Okay. Then what was another point of question?
Infrastructure.
Infrastructure, yes, that's infrastructure. So there's some kind of assumption. Okay, high-speed internet access, right? So if you want to build high-speed internet access in the village, okay, if everyone has a high-speed connection with a smartphone, then it's okay. But most people in the remote or rural areas may not have it. So that's the point where the government should try to extend minimum requirement, make point of contact, high-speed contact, speed internet contact points. Okay. That is a right term, village communication center or hub. Okay. So ordinary people, customer or patients go to the center and make high-speed connection with the patients. Okay. So we have to build some minimum high-speed connection. Okay. And that's that much is the amount that the government have to invest. Okay. So there's a kind of assumption that I have thought of. Okay. Other than that, maybe the only thing that you can do is 2G connection. Okay. So slow text-based communication. Yes. I'm not much knowledgeable in Indonesian society, but according to what I've heard after discussion with my former student, okay, maybe we may have to start humbly, okay, and think of that kind of slow connection. Okay, that's it. Thank you.
Okay, thank you. May I continue my questions? May I continue my questions? Okay. You are providing text communication by text since we have a slow connections here. My research group is dealing with natural language processing, and in my experience, even speech communication or written explanations, there are frequently miscommunications because this is a medical field. So how do you have any proposal to avoid miscommunications because of language misconceptions? There's my concerns. Thank you.
Yes, AI will surely make mistakes. That's big. There could be a big trouble. It's also a big trouble. And if AI makes many mistakes, frequent mistakes, maybe doctors may not want to choose to use, right? So just like a boy and a wolf story. Okay, if you make many false lies, then doctors do not want to hear it. So, but that's not the area that I can change. So we have to wait the improvement of natural language processing technology. Then maybe your team on natural language processing make a big contribution. Then, so that's the reason why I suggested my former student. Okay, that could be a good source, a good area of research topic. Okay, and with more improved technique in natural language processing in this field, maybe we can succeed in reducing the mistakes, miscommunications, and ultimately doctors have to check the validity or correctness of the AI scribe or summary of the discussion. Okay, so the only thing we can hope is that AI can reduce the burden of the doctors in diagnosis. Okay, they cannot improve, remove the task of text typing. Okay, completely. So we may hope to reduce the burden of doctors as much as possible. Okay, that's why I felt that while surveying or stories behind the remote or health, digital health, and I think we have to consider more and more, and we have to listen to what doctors say keenly. Yes. Doctors, if they do not choose to use this service, okay, if the doctors do not choose to use this, then it's all over, okay? It's a failure. So we have to satisfy doctors with as much accuracy as possible, okay? Okay, thank you.
Okay, thank you, Prof. Anyone want to ask questions? Okay, please. So,
Okay. 네, 안녕하십니까, 교수님. 질문 있으세요? I have two questions. The first question is, when you try to implement this POC in Korea, is there any resistance from the doctor? Because in my limited time in Korea, my perspective is a doctor in Korea practicing advanced medicine. I once took my wife to the university hospital because when she sneezed, there was some blood, and then the doctor suggests me to take CT scan. As a student without insurance, this is very difficult. So I go to the small clinics, and then my wife just inhale from nebulizer, and it is okay. So. Yeah, because the doctor is very careful to make diagnosis. So, do you think when they offer to use this telemedicine application, is there any resistance? And the second one is, I believe in South Korea, they already have integrated national medical record. So hospital, even small clinic can access the same medical record. Do you have plan in this application also to connect it to this medical record? And if so, is it difficult? Okay.
Okay, thanks for your question. For the first question, I haven't consulted or accessed the doctors. Okay, and in Korea, telemedicine or digital health is quite limited, and doctors are strongly against the use or proliferation of this kind of service. Okay, and it's highly regulated in Korea. So I felt, okay, there's no hope in Korea there. And I may not be able to make any kind of contribution. And another fact is that there are already big players in digital health in Korea already, okay, like big corporations. So, and they, in my belief, they already have most of the technologies, okay. But I'm not sure whether they have reached to my level of telemedicine, okay, and focused on patients and doctors. And in my belief, that most of the big players, business players in Korea, are more focused on business. So, and the two rivals or enemies, no, I don't know. So it's not easy. It may not be easy to realize my idea in Korea. So I thought of starting this concept in Indonesia or underdeveloped or developing countries. Okay. And I'm not I have little information in foreign countries, right? So I need a partner, and I looked and I long sought after my former alumni student. Okay, then we had a discussion, and then they already had similar ideas. Okay, with this smaller form. Then so we agreed to start pursuing Tentang BRIN. Then I also looked for another facilitator who can help me a lot in realizing service beyond technology. And we need the government sector or regulation and across different languages and culture, right? So we have to consider in bigger perspective to realize this kind of service. And what was the second question again?
Yeah, about the national medical record.
Sorry?
National medical record, is it possible to integrate the application into national medical record? But based on your answer from the first question, yeah.
Oh yes,
it
medical
also
record is really important. What doctors really want is medical record sharing across stakeholders. Okay, without that. Okay, when we go to a clinic or hospital, you share or measure X-rays or CT scans, right? And you go to another hospital, you have to do this measurement again, right? You have to share that kind of medical information. So I hope, and I want that Indonesia should make an initiative standardizing that kind of medical records nationally, so that all medical stakeholders, clinicians, hospitals can share their information. In that area, the privacy or accuracy, security is really important. Yes.
Okay, thank you.
Thank you.
Okay, thank you, Mr. Andrea. Is there any more questions? Okay, another questions from me, Professor. You mentioned earlier about languages, cultures, and I think you are fully aware that Indonesia is huge. There is one fascinating point from Indonesian that I think Indonesia is very diverse. It consists of, if I'm not mistaken, 1,300 ethnics. Yes, it's sort of diverse. So I don't know, maybe from one area to another area have different local wisdoms for themselves. And regarding this, what strategies do you think are most effective to build confidence in digital healthcare platforms? In relations with the patient trust, how to your opinion?
As I told you before, I'm a technology guy. I haven't thought much about social factors or cultural factors. I know the culture and social customs are important, and the language barrier across different ethnic groups. My small ideas are about starting small and expand one by one toward other areas. Okay, so it could be Java first or Sumatra first. Okay, go step by step toward other areas of culture. Okay. So my answer may not be very deep. Okay.
Okay. Sorry. Thank you, Professor. Is there any more questions? Okay. Mrs. Elvira, please.
Okay, thank you very much. I just curious about the Korean's standard or procedure if we want to produce or make some digital health services. what procedure or regulation requirement that the digital health services can use in the specific area, like in remote area, because in Indonesia, for the some product we have like technology readiness level for making it for the mass product or for the health services like chatbot. I just found the information about I forget if Gemini or ChatGPT that mistake about the natrium chloride and sodium chloride. It's quite dangerous for someone who follow the suggestion in Korean, especially, or for any country. If you know about the regulation for make some digital health services can apply for patient, what's we must to do, especially for some information, because I and my team want to develop like chatbot in hemodialysis, and we collect the trusted the data, but we cannot make sure 100% the answer is correct, like that the natrium, different natrium, but is have make someone like it same like poison for because different. So how about your experience on, and you can share about the Korean regulation for make we can apply digital health services for our product. Thank you.
Well, I think there is a question beyond much of my experience. Okay, I had some research with my former student on food and nutrient. Okay, that gave me some insight. Okay, but as for now, I haven't included the kind of aspect, food and nutrients. They will surely be included for post healthcare, right? Post healthcare or even remote health monitoring. And as for concerning regulation, I'm not sure I have any idea about that. The only thing, the most biggest hurdle is that the obtaining the recognition of doctors. Okay. After that, most problems will not be very hard to overcome, and the AI's capability concerning the food or local characteristics, local nutrients or food characteristics will be the domain of beyond my expertise. We may have to include work together with other team in that area, food and nutrients, or more, when we localize the kind of service. So the only thing I have, I think of as of now, is to standardize the backbone of the service. Okay. So on top of that, we can extend the service gradually. So that's the reason why the healthcare service is really complex, okay, immensely complex in that sense. Okay. So if you want to solve the problem once and for all, it's impossible. So we have to start small and extend one by one gradually. But I think we need to build a flexible design first. Okay, so that's my only hope. Okay, thank you for your question.
Thank you, Mrs. Elvira. Do we have another questions? Okay, we have more than 2 hours discussions, including the fabulous presentation from Professor Sin. I think we can conclude the presentation and QA session. I would like to thank Professor Sin for generously sharing his knowledge and experience with us today. And thank you to all participants for your active engagement, both on site and online, unless there is another questions come out. Okay. Let me conclude the presentation and QA session. I would like to hand the program back to the organizing committee for the next part of our agenda. Thank you very much. And please give Prof. Sin a big applause.
So, ladies and gentlemen, finally, we are now in the closing session for the sharing session. Topic: digital health service platform for anyone and from and everywhere. And to close this sharing session, I would like to invite Mr. Esa Prakasa, the head of Research Center for Data and Information Sciences BRIN. To Pak Esa, the time is yours.
Okay, thank you, Mbak Tanti. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. I'm Esa Prakasa on behalf of the Research Center for Data and Information Sciences, National Research and Innovation Agency BRIN. I would like to express our deepest gratitude especially to Prof. Sin Bongki, and also for all of participants that are joining either offline and online, during this sharing session. We are truly honored to have Prof. Sin Bongki from Pukyong National University, South Korea, with us today, sharing his insightful presentation entitled Digital Health Service Platform for Everyone and Everywhere. His presentation and idea provides a new perspective on how to provide health services for a large-scale coverage. I think this technology has a great opportunity to be implemented, especially in Indonesia, since we know the Indonesian people, that of course they will need health services. They are living and spread in many islands in Indonesia. I think more than 10,000 islands. And then the other thing also, by implementing this technology, we can ensure the health services with high quality can be provided to all people. We believe this session has opened exciting opportunities for future collaboration in any kind of collaboration, such as joint research, system co-development, or maybe joint supervision. So many kind of, or maybe joint research or joint funding, for example, especially in the development of digital health system. As we know, in Research Center for Data Information Sciences, we are covering 5 research areas. The first is information retrieval, and then knowledge and data engineering, human computer interaction and visualization, and natural language processing that currently organize this event right now, and then lastly is digital government. I think all of this area and can contribute to develop or maybe to realize the digital health system. Once again, thank you to Prof. Sin Bongki for his inspiring presentation, and thank you to all participants for your attention and contribution. We look forward to seeing you in the future PRSDI or Research Center for Data Information Sciences sharing session. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Thank you, Mr. Esa. Now, I would like to invite Mr. Esa to kindly present a token of appreciation to our honorable speaker, Prof. Sin Bongki. On behalf of the committee in charge, we would like to express our heartfelt appreciation to our distinguished speaker, Prof. Sin Bongki, and Mr. Tedu Ulinsya as the moderator, and also to all participants for your active participation today. We hope the knowledge share will be a lasting benefit, and it has been very pleasure to host the event. And have a great rest of your day. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much, ladies and gentlemen.
Waalaikumsalam warahmatullahi wabarakatuh.
Bapak Ibu, terima kasih atas partisipasinya.
Sama-sama.
Admin mana?